You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. According to my first guest, no more dentures. With us, we have an expert on the topic, Dr. Hadian. Dr. Hadian, welcome to the program.
Thank you. Thanks for having me.
Now, for people that don't know you, I guess you do more than dental implants. What are the different procedures the services you offer, and who's your typical patient?
Well, our typical patient is a tough question to answer because I'm not sure there is a typical patient. We offer so many different things, ranging from Zoom bleaching, which will give
whitening?
you that bright smile that everybody wants, and we do sleep apnea appliances for people that can't wear their CPAP machine, stop the snoring.
Is that right? So it works?
It does work. There was actually a medical study done that proved that for people to mild to moderate sleep apnea, it works just as well as a CPAP.
So it's just what, like an appliance you make that?
It is an appliance.
That does what?
It repositions the jaw, allowing the airway to open up.
Okay.
And get those couples back in the bedroom together.
All right, because I guess they have to sleep in separate rooms because of the noise.
The snoring, yeah.
All right, now, you also do like smile makeovers.
We do. One of my favorite things. Great before and afters. You know, people just come in, they want that Hollywood smile, and we give it to them. And other things, we do your general dentistry stuff, you know, the fillings, cleanings, crowns. But probably my favorite thing in dentistry is implants, replacing people's missing teeth, people that have dentures that don't fit, get them to be able to finally eat the right way. Those are gratifying.
In fact, you know, on the telephone you said there's very few things in dentistry where a patient, and I'm paraphrasing slightly, you said they're compelled to hug you.
Yes.
Really?
Yes. Oh, yeah. I would tell you that that is probably the number one thing. You know, I get hugs for other things, but the implants, the first time they can eat the right way, and the smile makeovers. I mean, you get tears and hugs on that one.
Okay.
You know,
now, IV sedation, you do you're big on sedation.
We are. Even though we love to joke around with our patients and have fun, there is patients that need IV sedation. There is patients that are very apprehensive, that have stayed away from the dentist for decades. And that's really a nice thing to offer someone. You know, these are patients that beat themselves up because they can't understand why they can't go to a dentist.
Just like a phobia.
It is. We have had cases where we'll watch a patient drive into the parking lot and they can't physically get out of the car. It takes them 2 or 3 tries. They finally walk in.
Wow.
And we get to a point where after a couple of visits with us, they're coming in smiling, they're bringing us gifts. So that's nice.
Now, when you say that you can do like 2 or 3 months or a lot of years of dentistry all in one day because of sedation,
You can.
Why? Or what does that mean?
Because we're able to make the patient so comfortable that there is no limits to what we can do. We can see them for 4 or 5 hours and it would seem like 10 minutes to them.
Really?
Most of the time, they don't even remember being there.
Like amnesia?
It is. There are amnesic drugs, basically. So it's the next day, you know, we've gotten calls from people that said, I'm sorry I missed my appointment. You know, I'm like,
is
okay.
That right? They look in the mirror at home and say, boy, my smile looks good today.
I woke up good today, but no, it's true. And that's a really nice option because those are probably the patients that beat themselves up the most.
Because people don't like going to the dentist. I mean, do you hear that?
Oh,
and I know
about 20 times a day.
You've made dentures over the years because we're talking about no more dentures today.
Yes, I've made dentures.
But you don't like them.
I don't. I despise dentures. And I'm not putting someone down for wearing dentures. I just know what people go through, the difficult times, the having to get up at a luncheon because you have to run to the bathroom and rinse them off, or the embarrassment if you're at a party and your teeth fall down. You know, these are terrible things. And to be able to help someone get past that is huge.
So, and I don't want to put words in your mouth, but the future of dentistry will be all denture wearers will be snapping them in to secure them in?
I can help it. It will be. Because think about it, if you have something just sitting on top of a piece of tissue, you know, how can it stay in place properly? You know, it teaches people to eat the wrong way. You know, instead of the normal motion that you and I have when we eat, they end up just biting up and down, which doesn't really grind up your food. You know, and you end up with GI problems and long list of medications for it. And it's nice when you have something to anchor them to. They actually snap into place, don't move, and you're able to eat the foods you never thought you could. Corn on the cob, she always pops up. It must be something everybody misses. Or pizza, which is one of my favorites. I had a patient that we did a case on, and he wanted to take me out for pizza because he could finally eat it without, as he put it, I can eat it like a man. And
Interesting.
so,
Are there a lot of people with dentures where you are?
oh, thousands. We could fill up Lincoln Financial Stadium a couple of times.
Well, if there's so many people wearing dentures, and you're saying it's so good to have dental implants to snap in or even to fix set of teeth, why aren't they all doing it? What's your take?
I really believe they don't know. They don't know the advances. They don't know that you don't need to replace every missing tooth with an implant. We can replace a full arch of full lower teeth with just 2 implants, 2, 4. I believe they think it's going to be a lot more expensive than it really is. And the people that ended up with dentures probably had bad teeth and bad experiences at the dentist, so they don't really go anymore. They figure, I don't have teeth, why do I have to go to the dentist? So
Yeah.
now it's getting them back. They have bad memories. And
It does seem painful, though, like a painful procedure.
pain is actually not an issue when it comes to implants. Remember that implants are placed in the bone. Bone doesn't really have nerve intervention. So most of the cases, most of our patients say, wow, that was it? And it's much less pain involved than an extraction or a lot of times even a filling. So people leave there very happy and very surprised.
So the newest trend in dentistry, if you had to say, so is replacing missing teeth. If you're missing teeth, dental implants.
No question. Best option.
Okay. So back to denture wearers. They benefit the most. Would you say that they benefit the
Absolutely.
most?
And the most immediate results. Because denture wearer can come to me and on the same day, I can place the implants, place 2 adapters on the inside that can snap that dentures onto the jawbone. They leave that way, that day.
Okay, and then their life gets better.
They're headed over to McDonald's that moment.
No, but I mean, they can eat and chew. I mean, do
They
you ever
can.
hear eating stories?
Oh, that's all we hear from denture wearers. I mean, that's the most important thing to a denture wearer. Everybody wants to look better, and we can make their dentures look great. Making teeth look great is easy for us. Making somebody comfortable so they can eat the foods they enjoy, that's where the joy is. You know, because the person that comes in shocked that they bit into an apple, you know, that's you and I take it for granted, but there's a lot of people that can't bite into an apple.
And they can do that. How old can you be to do this?
You know, it's interesting. I'm not sure there's an age limit. I have done cases people in the mid 70s. I have friends that have done cases people in the early 90s.
Why
You
would a
know,
90-year-old want to do this?
Because a 90-year-old wants to eat. You know, it's how can you put an age limit on wanting to eat?
I mean, statistically, are they more likely to fall out when
No,
you're that age?
No. Once that implant is integrated in the bone, it's there. It's staying with you. You know, so it doesn't matter.
So the bone just grabs onto that implant.
Accepts the implant as if it was a new tooth, a new root. So it is really phenomenal.
Now, I don't know if I told you this, but my mother, at 73 years old, her medical doctor said, you're too old. Because I told her, I said, I interview doctors every once in a while that say that about these implants. Asked her medical doctor, he said, you're probably too old, or you are too old.
For dental implants?
That's what she said. So do you think there's a lot of people that feel like they're too old
well,
for dental implants?
obviously they're getting some bad advice. So no, I'm sure there's people that think they're too old. You know, I've lived this way. I've had this denture for 30, 40 years. How much more do I really have? Well, to me, if you have 5 more years, 10 more years, 20 more years, wouldn't you rather be comfortable and eat the foods you want? You know, I don't see how you can put a price on that.
Okay, and as far as, okay, so on the consult, they see you, and they're wearing a denture. What questions do they have? Like, what are the frequently asked questions that they have?
You know, the most common question is, does it hurt? You know, so that we can knock away right away.
What do you
know?
say, by the way?
It doesn't. I can honestly tell them. It's not a painful procedure.
But there is some pain. I mean, because look, people need to know it's a real interview. I'm not endorsing you on this
Right.
program, but we can't say like painless, pain-free. But pain is not something that they're complaining about?
It is
usually?
not.
Okay.
So I can go back and think about all the hundreds of patients and their responses. And the general response is, oh, that's it?
Okay, good.
And, you know, so that's a good thing. And now, of
Now,
course,
during the procedure, they feel nothing.
they feel nothing. They're completely numb.
And what percentage are you sedating? Almost all of them?
You know, our office is known in the area for sedation, so we do see a lot more sedation patients. But, you know, for my implant cases, they don't have to be sedated unless they are dental phobic, or they have a lot of work that needs to be done and they just want to get it done quickly. But probably about 30% of our cases are sedation cases.
Now, is it true very few general dentists do sedation, IV sedation?
It is.
Like less than 5% in the country?
I believe it is less than 5%.
Why'd you do it? Why'd you get involved? I had a guy tell me the other day, because sedation sounded so good after talking to you, and I'm talking to a dentist, I said, why don't you do sedation?
Right.
Because it takes a long time.
Well, the training and everything, you have to, spend a lot of time getting the IV license and all these things. But to me, it was definitely because of my own experiences. Having, as I joked earlier that I'm the biggest baby, I remember a lot of uncomfortable situations.
Well, if you didn't like the dentist, why'd you become a dentist?
Well,
How did you become a dentist?
This is going to sound kind of, I think it's funny, but from an 8-year-old walking into the bathroom, and right there in one of our drinking glasses on the sink is my grandfather's dentures. Now that's terrifying to an 8-year-old. I wanted to run out. I thought, my grandpa's falling apart. His embarrassment running in there and, quickly putting him in his mouth.
I don't mean to laugh, by the way, but it's a great
it is
story
funny
here.
if you think about it now. I mean, it's. I don't know if anybody else.
So you saw that and you thought what?
Yeah, I mean, we had grandparents that lived with us, and I never realized my grandfather's teeth weren't attached to his head. As a kid, you assume that the teeth are in there, but you see him floating around in some kind of water in a jar, and it's scary.
And in your mind, you thought, I want to maybe.
I'm thinking, well, because I saw the pain in his eyes, the embarrassment. I'm thinking. Not at an 8-year-old, I'm not thinking I'm hoping to be able to solve this problem, but I realized it's a problem at that point. So as you get older, you're thinking, well,
like in high school, did you know you wanted to be a dentist?
I want to be a race car driver, but dentistry was number 2.
Okay. You want to be an orthodontist, I think you told me.
I did. I guess I was interested in the mouth. It's orthodontist just seemed like something that makes people happy. And that's, we talked earlier about, the hug thing. I assume orthodontists get a lot of hugs, so I'm after more hugs.
But you think you're getting bigger results as far as life changing? Because you say in one day their life's transformed.
Yes. There's no question. The denture patient that can eat, the young lady that can now smile because she doesn't have to worry that, she had a bad salad, or the patient that can't come into a building where there's a dentist because they're so afraid. To get that person to bring you baked goods, to give you a hug, to be in tears. You know what I mean? Like, it's funny because
they're so happy they're in tears.
Yeah, they're in tears, then I start crying, and it's it's a funny office. So, but those are true stories. We cry all the time. We get great notes from patients. That it's amazing. You don't realize how much people beat themselves up over these things.
I know some denture wearers. They don't complain at all about their dentures. They seem to be happy. Are you saying that there's no such thing as a happy denture wearer?
No, I'm saying that their idea of happy is different than what it used to be. Now that may sound kind of funny, but I believe they've kind of forgotten what it was really like to chew food and taste food. I know they can eat. People can eat without dentures in their mouth too. I've seen it. I still don't know how they do it, but they do it. Basically they're just rubbing the food together and swallowing it. But think about it. If your palate is covered by a piece of acrylic, because it is, on a denture, the palate's covered, you can't taste the food properly. You can't feel the temperature of the food because it's not touching any of your skin. So these things, they're happy with them because they are able to eat, but they're not able to enjoy. That's the key with these denture wearers. Now, I will bet you that if there was a way to test drive 2 implant or snap-on denture.
So like the denture wearers, you say tens of thousands in your area, they could go in, just try them out.
Yeah, if there was such a thing, is it?
Okay.
Trial. Take them for the weekend, take them for a test drive. Nobody would come back. They would keep them, because they realize how different it is. It's just wonderful. They can finally start chewing the right way, and grind their food up the right way, taste their food. These are big things, and it can be done in one visit.
You told me, I quoted you on this on the phone, I don't believe in dentures.
I really don't, because if you just take anybody and show them 2 dentures and say, if you put these in someone's mouth, how could they eat? It just doesn't seem right. You got a denture that just
point.
floats around. Your tongue is there wanting to push it out. It doesn't. What's to keep it from happening? You know what I mean? And I can guarantee you about 50% of those denture wearers, the bottom denture is in a drawer by their bed somewhere.
You said you hear people that say, "Doctor, I love my dentures. My dentures are fine." What do you say to that? Do you hear that? I think you told me that.
We do hear that, but if they love their dentures, why are they coming to talk to me about those implants?
Right.
So I'm not sure it's a love thing. It's they're okay with their denture. They've had it since they were 30 years old, which is really a shame. If I'm seeing a 60, 70-year-old person that has been wearing dentures for 40 years, there's other issues. That bone has started to resorb from years of that just rubbing on top of it. So these are things that people need to know. Eventually, without implants, they won't be able to wear anything. Those dentures will need so much adhesive.
So is it true, by the way, if you've been in dentures like 30 years, it's too late at that point? You cannot get dental implants?
It is not too late, because with the advances in implants and the different techniques now and the different radiographic modalities, we're able to do things we couldn't do before. We don't need as much bone as we used to place implants. They've come up with implant designs that are shorter but yet wider, giving you the same surface area as the long implants did. So a lot of patients that were told, yeah, you can't, there's not enough bone for you to have implants done anymore, they'll come and see us and are obviously very happy to see that there is.
Has that happened? I mean, that's happened where a patient says, my other dentist told me I couldn't do it.
It has.
What do you say to that?
Well, I never want to badmouth anybody. It's not that they didn't want to help the person. It's because maybe they didn't know.
Maybe they're training. Think it's training.
Exactly. So we just got to keep up with all the new stuff. And
so you love this?
I do.
Is it the happiest group of patients of all dental patients? That means you take a denture wearer and you give them something.
Yes, I would put them together with the Smile Makeover and the really phobic dental patient that loves IV sedation.
Smile Makeover. Because that's one of the things they get. They come in, I guess they want to eat and chew, but now they get this beautiful smile.
Everybody wants to look better.
Now, you're a dentist, so you probably think the smile is the most important thing. How important is the smile?
I really think it is the most important thing. And you see it every day. I've had my own patients. I've met new patients that, at first glance, you kind of step back because you're like, oh my God, he's may not be the nicest guy in the world. Just no smile, just looking at you. And then you find out after you fix their smile that they are some of the nicest people. They just never smiled because they hated their teeth. They didn't want to smile. It's amazing, the transformation. We see it all the time, and not just in the grumpy looking person looking happy. It's the women that come in with new hairstyles, makeup, wearing lipstick that they never wore before, all of a sudden losing weight. It changes people's lives.
So it's a boost in their self-esteem.
Absolutely. That's what we love to see, the before and after picture. The person that comes in, the clothing a lot more conservative, not really smiling. And we take a picture 6 months later and, they got the flashy colors and bright lipstick and new makeup, new hairdo, and they're talking about Match.com and things like that. So,
so now, what about the people that are headed for false teeth? That means their teeth are really, really bad, and they have bad gums. With bad gums, can you get dental implants?
Yes, and that's a great point there, because we have had some consults where they've come in and said, I'm sure this won't work for me because, I was told that I had bad gum disease and the bone has gone away from me. What people need to realize is that once the teeth are out of a mouth that had gum disease, the source of the problem is gone. And the body will actually heal. The
so
bone
like the
will
infection is
the
gone.
infection's gone.
Interesting.
The teeth were the problem. And once those are gone, now you're back to healthy bone. You can get implants, and the implants will be fine.
Is this one of those things where people say, I should have done this years ago?
Absolutely. Hear it all the time.
What do they say?
It's usually the person that's thought about it for a long time, has come in for a couple of consults, and finally they get it done. And we always hear, my goodness, I wish I would have done this 10 years ago. Because they go back and think, 10 years of, cutting up that pizza, 10 years of worrying about, smiling and will my teeth fall down. It could have all been fixed, and so easily. So yeah, it is a common question. common comment.
Now we're short on time. You brought a model. What are we looking at there?
Well, we've been talking about this so much, I wanted to actually be able to show people what we're talking about. So if we're looking at a lower denture here, this is, if you can get up close on this, this would be what it would look like. The implants would actually be in the bone, but there is a piece that sticks up above the bone level. And then when you see on the inside of the denture, there's actually these attachments.
Here, point that toward me. Let me take a look at that. Okay, so that right there is like snaps.
Exactly.
Okay.
The housing here, and it will actually snap into place. Now, hopefully in your mouth it won't make that noise.
Let me try this. Okay, so this is the lower.
It is.
Okay, it seems a little hard. I'm not exaggerating here. I mean, could you make it to where it's too hard to snap in and snap out?
Yes.
I mean, if you have arthritis, there's no way you're going to get this out of your mouth.
That's a great question. On the inside, those little gaskets, they have different attachments you can put in there. They're color-coded on how much pressure we want on there. So yes, if you are 95 years old and you finally got what you wanted, a denture that stays in place, you want to be able to take it out too. At some point, you got to have to clean underneath there. So yeah, there's ways to set.
So a full arch of teeth. So what's the bottom level or the entry level? I mean, like what's the minimum to the maximum?
2 implants. 2 implants are the bare minimum.
Where do you put them?
We would separate them probably canine to canine.
And they get a full arch of teeth.
Full arch of teeth.
Snap in, snap out. What's the next level up?
The next step would be the 4 implants, where we can actually give you a fixed set of teeth, which means that they will actually screw in place.
So full arch that don't come in and out.
You never take them out.
Wasn't that what everybody wants?
That is what everybody wants. And it's really the ideal. We can go 6 teeth, you can go 8 implants and actually put regular teeth on them. They aren't even it's not a denture tooth at all. It is crown and bridge. It's porcelain. You can get them individual crowns. So there's so much that can be done. That's why it's important to come in for that consult to find out what's right for you.
Now what about the upper? How many implants?
Upper, we try to go 4 implants, and we can do all the teeth on there. We can do a snap-on denture where we can actually cut out the palate portion so you can taste that food and enjoy life a little bit more. We can do 4 implants that hold teeth screwed in place. We could do 6 implants and no denture at all. So there's a lot of choices there.
So no more dentures. Are you going to wipe out dentures in your town?
I am. That's my goal.
Is that right? Because there's a lot of people, you say, with them.
There
so
is.
it's just they're afraid.
They are.
It seems like it hurts.
Yeah, they are afraid.
It's hard to believe that it doesn't really hurt that much.
It really does not. I wish I could have lined up some of my patients back here so they can give you the testimonials, but they don't. And they are in bone, which bone doesn't hurt. The procedure is quick and very, very little pain. I always tell my patients, probably going to have more pain from a filling and definitely more pain from an extraction.
Okay, now how it's normally done, you say, and maybe make sure I have this right, is they go to one place that does the surgery, then they go to another doctor that puts the teeth on top, and you do it all there.
Yes.
Is there an advantage other than convenience?
Yes, because the person that's going to be restoring those implants, the person that's going to be giving the teeth, is the person that's placing them. So the positioning of those implants, everything is done with the end result in mind. How do I want this person to look? You know what I mean? Where do I need those implants to get that smile that I want? I'm not dependent on another person placing them, hoping they place them in the right spot. Mm-hmm. So yeah, it's just easy, and I don't think a lot of people want to go to different places. I think they like just staying with me, and we build that relationship, and I want the hugs. I don't want the hugs for anybody else.
Okay, so they really do. I mean, they send you cards, and
they really do. Christmas time, food. I get a lot of baked goods.
Is it more women that come in, or more men, or it's equal that are coming in for this?
It's actually equal. One of my favorite stories is a gentleman in his early 70s, a farmer in our town, and great guy, great personality, has had crowns done. They were done 20 years before at another office, and they fall down. He had his front 6 teeth were crowns, and the front 2 were missing from an old accident when he was little, and they had bridged those teeth, and the whole thing falls down. Now, he's, as he put it to me, he goes, "I'm not a model, doc, but I don't want to look like this." So we see him, and we explain to him that there's removable appliances, and you know, I have to tell him that, even though I obviously don't like removable appliances. And right away he said, no, doc, there's got to be another way. And when I mentioned implants to him, he said, let's do it. And we got him in a couple of days after that, placed the implants, temporized it the same day.
What does that mean, temporize the same day?
We put 6 teeth on there that same day. And he was able to leave with a smile. And he is my best salesperson now. You know, he tells everybody. He loves to show his teeth. Anybody he sees, see my teeth? You know, he'll tell him. He'll say, go see Dr. Hadian. He did it for me. And you know, so it just shows, you know, guy in his 70s. You know,
that's young today, by the way,
matter.
70s.
It is, you know, and, you know, the question about why would someone in their 90s do it? Why wouldn't they? You know, if I had a week left, I would do it. You know, I just feel like I love to eat, so if I can get an extra week of good eating, I'm ready.
You don't believe in dentures.
I don't believe
That's another
in dentures.
one of your lines.
No.
I don't believe in dentures.
No, I don't.
So it's a disservice to people to give them dentures. I mean, that's how you feel now.
That's how I feel. You know, I don't want to step on any toes, but my feeling is that dentures are, with what's available out there, it is a disservice. You know, if we don't give people that choice, then shame on us.
Now, we are out of time. Final message for a patient that's watching this, but they're still skeptical. What do you say?
Come on in and talk to me. You know, the consult won't cost you anything. And we'll sit down and talk and go over the choices and take it for a test drive.
Okay, good. And finally, I should mention, because you said, Randy, could I just mention how friendly my staff is on this? Everybody comes on my show.
I'll get in trouble if I don't mention it.
I mean, is that a problem
Best
out
staff.
there? But
Best staff around.
Is that a problem out there where people have people that aren't friendly?
Well, no, I mean, I feel like we're a service industry, you know, and you and I believe that, yes, everybody should be friendly, but that's not like that nowadays. I mean,
so like your people care.
It's rare to get good service.
So they care.
They do care.
Okay, good. I want to thank you for coming on the show.
Thank you.
No more dentures.
No more dentures.
According to you. All right, thanks again.
Thank you.
You've been watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.